Hi everyone. I did my presentation and my project on post-mastectomy lymphedema. I had the opportunity to interview Peggy, who was a breast cancer patient who has lymphedema as a result of a double mastectomy, and her physical therapist, Donna Kubik. So what is lymphedema? Our lymphatic system stretches from our head to our toes. It's a network of channels and nodes, and oncology patients, about 1 in 3 oncology patients will have lymph nodes removed as a result of oncology surgery. Breast cancer patients who have mastectomies will have lymph nodes removed from their axillary region, which is under the arm. And normally there is about 20 to 30 on either side, so a portion or all of them may be removed depending on how extensive the cancer is. And when those nodes are removed, the lymphatic fluid that is normally traveling through that network becomes backed up and can't filter waste from the body through urination. So it starts to back up in the affected body region, which is typically the arm or the chest wall, and causes severe swelling. There's an audio clip on this slide that's a little too long for me to play for my presentation, but it's just the physical therapist that I interviewed, Donna, discussing what lymphedema is in a little bit more detail. How common is lymphedema? About 35% of patients who are in stage 1 or stage 2 of breast cancer will have a mastectomy. 10 to 15% of them will develop lymphedema in some form. And about 1/3 of those patients who develop mild to moderate lymphedema will progress to chronic lymphedema within 5 years of their initial onset. So most women will develop lymphedema after having a mastectomy, and those who have a mastectomy and radiation are even more likely to develop lymphedema because radiation will damage the remaining lymph nodes in the affected region. Signs and symptoms. As you can see in these images here, the first sign is going to be severe swelling of the extremity. Typically, lymphedema is felt before it is seen, so a patient who is suffering from lymphedema will feel a fullness and a tired and achy feeling in their arm or in their chest. If they let it go too long, they might feel it in their neck and their face and in their jaw area. They'll have a limited range of motion, and they're going to have a tightness of the skin and a tingling sensation in the hands and fingers. Lymphedema also is associated with some psychosocial conditions like anxiety, depression, affected body image, impaired sexual functioning, reduced quality of life. And that's because patients are not only coping with the fact that they just had their breasts removed, but also with now that they're having a lifelong condition that's going to require constant management. And if they let it go unmanaged, they're going to have visual changes in their body that others are going to see. Lymphedema therapy is typically done by a LANA certified therapist. That's the Lymphology Association of North America. The therapist will educate and train the patient on manual lymphatic drainage, which is a light massage technique that works the fluid very lightly with very light pressure against the skin, works the lymph fluid back through the network of the lymphatic system. So it's important that patients are educated properly on the directions that the lymphatic system travels so that that fluid is pushed in the correct direction. If not, they can cause additional swelling. Therapists will also do a wrapping and bandaging technique to help compress the arm or the affected limb to reduce the swelling as much as possible and then fit them into a compression garment. So the bottom image on the screen is the wrapping technique, and the top right image is a compression garment that's called the Starry Night. It looks like Vincent van Gogh's painting. Pretty cool. I'm also wearing one here. It stretches from my wrist to my upper arm. It's important that it travels, that the garment fits the entire channel in my arm. Otherwise, if I only had it from my wrist to my forearm, the swelling would just build up even more in my upper arm. In addition to compression garments and massage techniques and wrapping, patients with more extensive lymphedema might be put on a compression pump. And that is what the top left picture is wearing. She's wearing a pump that's connected to a sleeve and a chest piece. And that pump probably has 4 chambers, which compress and decompress air in 4 areas to help mimic manual lymphatic drainage. So Peggy was diagnosed with stage 2 cancer of the right breast in June of 2014. In addition to having her right breast removed, she elected to have her left breast removed to prophylactically prevent cancer in that breast. She had 15 nodes removed from her right side and 12 from her left side. She started having therapy in January of 2015 after she noticed a tired and achy feeling in her arm. She did really well. She got garments. She learned how to do exercises and lymphatic drainage. But she was also undergoing radiation at the same time. And like I mentioned previously, radiation will greatly affect somebody's outcomes with lymphedema. Because she was having radiation on her right side where she had already had half of her nodes removed, the remaining nodes were damaged after the radiation. She had a lot of skin issues and a lot of infection around her incision site. So she could not continue with therapy for about 4 weeks. She returned in April of 2015, and her arm had swelled to about 1.5 times its original size, and it was bigger than when she initially started with Donna for lymphedema treatment in January. So Peggy had to be fitted for new compression garments, and now she also has to use a compression pump every day for 30 minutes to help reduce the swelling. In addition to going through cancer treatment and the major changes that has on your mental and emotional well-being, Peggy was now overwhelmed with the fact that she had to deal with this lifelong condition of lymphedema. She has a lot of body image issues. She calls herself a closet changer. She doesn't like to change in front of her husband. She doesn't like her children to see her without her sleeve or without a long sleeve on, because she's really self-conscious about the size of her arm. And as she said, she feels uncomfortable in her own skin. She tries to make the best of it by buying fun compression garments like the one I'm wearing and the one in the picture. But she still knows that it's something that she's going to always have to take care of, because otherwise, if she doesn't manage her lymphedema, she's at risk for infection and for hospitalization. So Donna was Peggy's therapist. Donna is certified by Atlanta. She works for Pinnacle Health, and she's also their survivorship training and rehabilitation program coordinator. Donna worked with Peggy to improve her range of motion, endurance, and reduce swelling. Donna also got her fitted for the compression garments and set her up with an in-home compression pump. And Peggy says that Donna really improved her emotional and mental well-being, because while she was there for therapy, she did not feel like she was meeting with a therapist. She felt like she was meeting with a friend. Donna really helped her by surrounding her with a positive environment, socializing with her, and staying away from any talk about her cancer diagnosis or other treatments. So some limitations with lymphedema, other than distress, patients may encounter financial hardships due to co-pays for therapy visits and durable medical equipment. One of these garments here is about $250 to $300, sometimes even more, and that's just for one of them. So you might have to have 2. Insurance companies only cover 1 per year, and typically they need to be replaced every 6 months. And compression pumps can be very expensive as well. And if the financial hardships of paying for lymphedema isn't enough, patients who let their lymphedema go unmanaged will have to deal with the out-of-pocket expenses of infection and hospitalization. In addition to that, family members often have a very hard time with lymphedema diagnosis because they don't really understand the condition. They see swelling and they think it will go away, but they don't understand that as a patient, the patient is living in constant discomfort. They're living with constant tightness, constant swelling, constant fullness feeling in their arms, and it's overwhelming that they have to tolerate it for the rest of their lives, and that it will only continue to probably get worse. That's another thing, is lymphedema doesn't really ever get better. Some precautions with lymphedema is to seek medical attention at the first sign of swelling, to have an evaluation with lymphedema therapists, especially if you're going to travel on an airplane. A low-sodium diet, compression bras will also help reduce the possibility of swelling in the chest, which can lead to the arm. Keeping limbs elevated whenever possible, and new tests like LDEX measurements, which require special equipment, but some oncologists are using it to see if patients are predisposed or at risk for lymphedema. Again, there's another sound clip on this slide from Donna, the physical therapist I interviewed. If you would like to check that out, it's just a little bit more on precautions and some encouraging words for those who might have lymphedema. As for Peggy, she is definitely doing better now. It's still going to be a battle for her, trying to find time every day to sit on a compression pump for 30 minutes, and also knowing that she's always going to be wearing uncomfortable compression garments at both day and night. But she is definitely doing better because she knows she's moving towards survivorship and that she will be entering remission soon, and that she, this is one side effect that she might have, but in the end, she still has her life, and that's what's most important. Thank you guys so much, and have a wonderful day.